Does castor oil work for treating erectile dysfunction? There is no robust scientific evidence supporting castor oil as a treatment for erectile dysfunction, and it has no MHRA licensed indication for this condition. You've probably seen claims online that castor oil can help with erectile dysfunction. But does the science actually back this up? Let's be clear from the start. There is no robust peer-reviewed scientific evidence supporting castor oil as a treatment for erectile dysfunction. Whilst castor oil has traditional uses as a laxative, it has no MHRA licensed indication for ED. It's not recommended in NICE guidelines, and it's not something your GP will prescribe for this condition. This matters because erectile dysfunction is actually quite common in the UK. It affects many men, particularly as they get older. And here's the important bit. ED can be an early warning sign of something more serious, like cardiovascular disease or diabetes. The arteries in the penis are smaller than the ones around your heart, so they can show signs of problems earlier. That's why getting a proper medical assessment is so important, rather than trying unproven remedies you've read about online. So what is erectile dysfunction exactly? It's the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual activity. Now, occasional difficulty is completely normal. We're talking about when it happens consistently over time, typically for at least 3 months. The causes are quite varied. Physical causes include cardiovascular disease, where reduced blood flow affects the penis. Diabetes can cause nerve damage and vascular complications. Hormonal imbalances, particularly low testosterone. Neurological conditions like multiple sclerosis or Parkinson's disease. And certain medications, including some antihypertensives, antidepressants, and antipsychotics. Psychological factors are equally important. Anxiety, depression, stress, or relationship difficulties can all contribute. Often, ED has both physical and psychological components that interact with each other. Lifestyle plays a big role too. Smoking, excessive alcohol, obesity, and lack of physical activity all increase your risk. Now, what about evidence-based treatments? These do exist. The first-line treatments are called PDE5 inhibitors. You might know them by names like sildenafil, tadalafil, vardenafil, or avanafil. These are proven, licensed treatments that work by improving blood flow to the penis. Your GP or pharmacist can advise on safe, evidence-based options that are right for you, but these aren't suitable for everyone. They're contraindicated if you're taking nitrates, nicorandil, or riociguat because of the risk of severe hypertension. That's a dangerous drop in blood pressure. This is exactly why you need proper medical assessment before starting any ED treatment. If you're thinking about trying castor oil anyway, you should know about the risks. Avoid applying oils to genital skin without professional advice, as they can irritate sensitive tissues and cause allergic reactions or discomfort. And remember, you're using something with no evidence of benefit and potential for harm. So what should you actually do if you're experiencing erectile difficulties? If it's been going on for 3 months or longer, make an appointment with your GP. They'll do a thorough assessment, including looking at your cardiovascular risk, checking for underlying conditions like diabetes, reviewing your medications, and discussing psychological factors. Your GP can then discuss evidence-based treatment options that are appropriate for your individual situation. They'll consider your overall health, any other conditions you have, and medications you're taking. Treatment might include lifestyle changes, psychological support, or licensed medications prescribed as appropriate for you. Remember, erectile dysfunction isn't something to be embarrassed about. It's a medical condition that deserves proper medical attention, and it could be signaling something important about your overall health. Let's recap. There's no robust scientific evidence that castor oil helps with erectile dysfunction. ED can be an early warning sign of cardiovascular disease, so proper medical assessment is essential, and there are proven, evidence-based treatments available through your GP. This information is for educational purposes and does not replace medical advice. Always speak with your healthcare professional for personal medical advice about erectile dysfunction or any health concern. Have you found this helpful? Let us know in the comments. And if you'd like more evidence-based health information, please like and subscribe.